Hey everybody, Dr. Nuveen here. On today's video, I'm going to be talking about expanders. We get a lot of questions in our practice from parents about whether or not their child needs an expander. Actually, often the question is, does my child need a spacer? Does my child need a spreader? They're all the same thing. Basically, an expander is a special appliance that we glue into a child's mouth that helps widen the upper jaw. On this video, I'm going to explain when we use them and how we use them. Okay, here we are with what we call a rapid palatal expander. In short, we call it an RPE. And what this appliance is designed to do is widen the upper jaw. Now, on young patients, the upper jaw is simply made up of two bones separated in the middle by what we call a suture. Now, those bones are not fused together yet. As the patient matures, those bones fuse together and we can't widen the upper jaw with an expander. So we want to be able to use this when the child is still immature. The best time in my practice is 8, 9 years old or so. We can use them up to age 12 to 14, but beyond that things get really difficult because the suture starts fusing together and we can't push the two bones apart. So now that you know how it works, I'm going to explain this whole contraption. So these little attachments that we have on these molars, these are permanent molars in the back, and these teeth on the side are baby teeth, and then these are permanent teeth in the front. These circles back here of metal we call bands, and they wrap around the permanent molars. And then across the roof of the mouth are some wires, and then they also extend forward. In the middle of those wires is this funny looking object called a screw that is the whole engine that drives the expander. And what you do with this funny looking thing I've been holding here, we call this the key. You use the key to turn the screw, and that widens the expander. So let me show you exactly how it works. I'm going to put this key into the hole in the roof of the mouth, or in the screw, and then I'm going to push this back until it stops. That is one turn of the screw. We will often ask patients to turn the screw once a day for 14 days, and then they come back in and we check to see how the progress is going. And that's exactly how you do it. Now, the tricky part with turning the screw for a lot of parents is, of course, there's a tongue here, the child is squirming around, and it's difficult to get this screw or the key out of the screw without pulling it back. So the most important thing is when you do this turn is to complete the turn, push it back in the patient's mouth, again this is the upper jaw, until it stops, and then you have to wiggle this key out without pulling forward. Of course, it's stuck. There we go. That keeps that turn in place. It also brings the next hole up so that the next turn can be done on the next day. If you turn it back when you're taking this key out, like this, you've simply undone the turn that you just put in. So you want to make sure you finish the turn, wiggle the key out, sorry, it's easy for me to do, there we go. Wiggle the key out and leave it like that. That's your turn. Now, when do we use these expanders? I use these expanders for patients that have certain types of bite problems, also in patients that have very, very narrow upper jaws. And typically they're one and the same. But a special bite problem that we might use an expander in is called a crossbite. And that's when the upper jaw is so narrow that the upper teeth are actually biting on the inside of the lower teeth. Okay, well that's enough detail for today. Thank you so much for listening, and I'll see you in the next video.